All right. Okay. Hi everybody. So we're back with another installment of coping with COVID-19 or just generally mental health awareness video. So as a reminder, I'm Ross and this is Sally. Together we're your counseling service faculty team. And today we have a special guest, Margaret Thomas, who's one of our library faculty members. And here, we're just here today to talk a little bit about media literacy, specifically social media literacy. Given the volume of information that comes across social media, we just thought it might be helpful to talk about how to manage that and protect your mental health while you're in that stream of information.
Yeah. If I can jump in too, Ross and Margaret, it's just I think it's such a vital topic right now because I know for myself, and Ross, you and I have talked about this, that many students we're working with are experiencing a lot of anxiety or feelings of depression or hopelessness. And when we talk to them about it, we can kind of track it back to some of the information or misinformation that they're ingesting through their social media feeds.
Yeah, and I was especially intrigued by this topic because of some recent research that's been done that shows that people who are especially vulnerable to extremist ideas are often targeted by some of the ugliest and most negative memes on social media. And the majority of those memes have to do with actually trying to promote racial hatreds. So that was interesting to me. And the good news is that there are some tools that you can use to cope with this flood of information on social media or just on the web in general. And the one that we're going to talk about today is called SIFT. So just a 4-step method for quickly determining if something that you see on social media is worth your attention or if you should just move on.
Oh, okay. So when you say SIFT, is that SIFT?
Yes.
Like sifting through the news appropriately?
Right. Yeah. And SIFT is an acronym to remind us about these 4 steps. Should I talk about the 4 steps now or?
Yeah.
I think that would
I'm very curious to hear about that. That'd be great.
So SIFT is part of an initiative called the Digital Polarization Initiative. And the idea is to try to improve civic discourse by developing web literacy in college undergraduates. And so the idea behind SIFT is that when you come across a piece of information, let's say on social media, first you want to be aware, did it trigger some strong emotional reaction? And that is often a red flag that it may be misinformation or disinformation. And so the first step, the S in SIFT, is stop. So if you feel that strong emotional reaction, don't share what you found, but stop, because it may be misinformation. And then the second step, investigate the source. So I stands for investigate the source. And one of the ways that you can do this that I find really intriguing, it doesn't always work, but it often works, is to go to Wikipedia and check the source of the information. What is the consensus online about that source of information? And you can see in just a few seconds what the consensus is about whether this is a credible source of information or not. And then the third step, see if you can find better coverage. Is this information covered in more mainstream news media? So first of all, see if it turns up there. That might reassure you that it's been vetted and is accurate information. And then the fourth step, the T in SIFT, is to try to trace back these claims and quotes and pictures to the original source. And Google actually offers, probably all browsers, offer a tool for doing that where you can put in a link to a picture and it gives you a method for tracing that back so you can see where that picture actually came from originally. So within an average of about 90 seconds, you can decide whether a piece of information is accurate or whether you should skip it and move on.
Okay,
Terrific.
can we go through the SIFT one more time, just real quick? So S is stop.
And I don't need to tell the two of you that. So this is the idea that it triggers our amygdala, right? It triggers that anxiety response, that emotional response, and that is exactly what a lot of these memes on social media are designed to do, to trigger an emotional response, because then you're more likely to share it and it's more likely to go viral.
Yeah, and that is of benefit to the social media companies in terms of their monetary gain from that sharing.
Yeah. So this is, it seems on one level obvious, stop, but it's really hard to do, I can say, with folks, sitting with them as a therapist with all sorts of kind of amygdala reactions. If you feel something strongly, I liken it to like an emotional current, like a river would have a current, and it's going to pull you in a direction, and it's hard to get out of the current, to pull over to the side and not let it just take you into a quick share.
Right.
It's interesting. Yeah, it's interesting, Ross. I'm glad you're bringing that up, because that makes me think about some of the other things that we've talked with students about for kind of managing strong and powerful emotion is maybe it's stop and take a breath. Big breath in and out, or a couple of breaths in and out, to just settle that amygdala response before, and that might help with the stopping. And then that might kind of get one's frontal lobes and critical thinking back online to then do the next thing, which is the investigate, right? The I stands for investigate.
But even just that stop step, it seems so critical to begin to at least notice that we had an emotional reaction to a piece of information, and you start to see that as a red flag.
Yeah, and
you don't do the other three steps. Maybe you just stop, and maybe that's enough.
It seems too that can be so powerful, Margaret, because the stop also can help interject some choice and consciousness and intentionality about what the next step will be. Will I keep doing the SIFT of investigate? What was the next one?
Find better coverage.
Find better coverage. Yeah, and then trace. Or like you said, maybe it's like, oh, I don't need to do anything with this.
Yeah,
I just need to delete this from my feed, or just move on. Or
I don't need to share it.
Yeah.
I don't need to be part of the problem.
Yeah.
Right. That seems like an important frame, is that you're actually being a part of the solution by doing these 4 steps, if you're doing them consistently, in terms of helping other people, but also, helping yourself. It's not really good for your mental health or even your physical health to be, to have all these kind of stress hormones that tend to get kicked up when you have a belief that's really evocative, but faulty, or exaggerated. That's just it's not good for you. And if people are ramped up long enough in this way, they can end up kind of getting to an exhaustion phase where they start noticing they feel kind of depressed, like low energy, low motivation, difficulty feeling pleasure in things, just feel kind of listless, maybe even hopeless. So what you're talking, this SIFT is, I think, has 2 benefits, one for the greater good, the social good, but also protecting our own mental and physical well-being.
And also, I guess, being aware of what's going on in the background with some of these bad actors that are creating misinformation and disinformation. And remember that when you respond to something that they send out and you do share, or it goes viral, you get more of it. Now you're targeted likely to respond to these extremist points of view, and that means that you'll be getting more of it. So, what does that do for your mental health?
Right.
Boy, this is really important.
It's just so important. But also the analogy I'm making right now, as I'm taking all of this in and digesting it mentally, is I was just thinking it's akin to eating. And what are we ingesting? Are we ingesting food that's healthy for our emotional well-being in our bodies? And then what news are we ingesting? And is that supporting our mental health and emotional well-being or not? And then how are we sharing that out? So it's not, it's about ourselves and about our communities as well. Yeah. Margaret, if students wanted more information, or is there a website where they can get more information about SIFT, or learn about other resources?
There is a website where they could learn more about it, and I'd be happy to put that up. And the good news is that at least one English instructor at the college is teaching this now, and she's been really excited about the results. She's found that students really respond to it, and they really appreciate having just a quick way. I don't have a long time to spend figuring out if a source is accurate, but if it only takes me a few seconds, maybe I can do that. At least I have some tools for how to do that. So yeah, I'd be happy to put up a website where students can get more information. And Sally, I thought it was really important what you were saying earlier about the impacts of social media on students and all of us, and how that lead to anxiety and depression. So just being aware of that, I think, is important.
Super. Thank you so much, Margaret, for being with us today, and we'll get that information, the web link, attached at the end of this presentation.
Well, thank you so much for inviting me.
This has been terrific.
It's been really great.
And
so as a reminder, the counseling service, while we're in session through the end of spring quarter, and then during summer as well, we're available to you via Zoom. And Margaret, I think you and the librarians are available to help folks too if they want some specific consultation around this.
You can just go to the library website and you'll find all the information about how to reach us.
Great. So keep the library in mind for your future endeavors, and as you're exploring how social media impacts your mental health and emotional well-being. And keep counseling services in mind. As a reminder, you can always reach us at counseling@spscc.edu. Take good care.